Welcome to Medicare Tuesday Talk. My name is Kimberly. I'm a local health and life insurance agent licensed in South Carolina, Maryland, and Pennsylvania, here to answer your Medicare questions. So today, what are we going to discuss? Well, Medicare coverage. What's covered and what's not covered. Why is this important to understand this? Well, you want to make sure that you have access to your necessary healthcare services and treatments. Medicare provides comprehensive coverage for many healthcare needs, but there are limitations and there are gaps in those coverages. So what are covered services under Medicare? Well, you have inpatient hospital care. That includes semi-private patient rooms, meals, general nursing, and other hospital services and supplies. You have doctor visits. That's your primary care physician, your specialists, and certain preventive services. You have outpatient care. That includes ambulatory surgical centers, outpatient hospital departments, and emergency room visits. You have preventive services that are covered, such as screenings for cancer, cardiovascular disease, diabetes, as well as vaccinations and counseling. Also, you have prescription drug coverage, which is covered under Part D, or if you're in a Medicare Advantage plan, Part C. You have home health services that includes skilled nursing care, physical therapy, occupational therapy, speech language pathology services. Also, hospice care. That's provided for individuals with terminal illness, and it focuses on comfort and quality of life. So, now that we discussed what's covered or what's not covered, there are limitations and exclusions. Some of those exclusions are cosmetic procedures. Generally, they are not covered unless it's deemed medically necessary. Long-term care, such as nursing home care and custodial care, and most dental care. Routine vision and dental care. Those things are not covered unless it's medically necessary. Acupuncture. That's typically not covered under original Medicare, but you may find some Part C Medicare Advantage plans that cover it. There are certain prescription drugs that are not covered. They're not included in the formulary. So that's your Part D or Part C Medicare Advantage plans. So you want to understand your Medicare Advantage coverage if you're on a Medicare Advantage plan. Why is that important? Well, because especially when it comes to prescription drug coverage, the formulary is not a one and all. It can vary. So if you're not working with an agent, when you're choosing a plan, you have to look at every single medicine you take and make sure it's covered and how it's covered. So I encourage you to work with an insurance agent. Also, reviewing other plan documents, such as the summary of benefits, making sure you understand what the limitations are, what the exclusions are, and what's covered, and so that you don't get surprised with unexpected expenses. So how can you take care of those coverage gaps for things that aren't covered by Medicare? Well, you have other options such as supplemental insurance. You have hospital indemnity plans, you have critical illness plans that can cover some of those things and help with that cost. Also, you have Medicare supplement plans that may cover things not covered by Medicare. And then also, you can open up a HSA or FSA. Those are health savings accounts or a flexible spending account, and you can use those pre-tax dollars to cover costs not covered by Medicare. You want to make sure you understand the eligibility and coverage criteria for specific services and treatments, because you do not want unexpected expenses. Trust me. So in conclusion, what's covered by Medicare, and also the limitations and exclusions, and how you can cover yourself in those coverage gaps. I encourage you, pay close attention to what your plan covers and what it does not cover so that you're not hit with unexpected expenses. You can seek assistance from your healthcare provider, also a licensed insurance agent like myself. Also, you want to explore supplemental coverage options because some of those plans can help cover those gaps as well. Thank you for tuning in to Medicare Tuesday Talks. Until next time.